Barnabas Health. Life is better, healthy.
So I'm often asked the question about heart attack signs and symptoms in women versus men. And to understand that whole subject, you really have to think about two things. The first thing you have to think about are the warning symptoms for heart attack. And then the second thing you have to consider are the symptoms should you be unfortunate enough to have that event. So the warning signs come because you have a narrowing in a heart artery and you don't have enough blood flow to the heart muscle when you're exerting yourself and so forth. So it turns out that in women, the symptoms that they experience from a narrowed artery are different than men typically. So a woman might complain of, for instance, shortness of breath, and it may happen that, for instance, walking up a flight of 10 steps, they become a little more winded than they might have otherwise. In addition to that, they may experience back pain. They may experience extremely subtle symptoms, nothing very severe in particular. Men tend to manifest a more typical type of chest pressure, chest pain type of a thing, but I want to emphasize that the intensity of whatever the experience is really is not an indicator of the severity of the problem. You can have very minor symptoms, whatever they are, and still have a very serious problem. So going forward to the symptoms from a heart attack per se, that's when that narrowed vessel becomes completely blocked. And that typically happens over a short span of time or even suddenly. And then the symptoms between men and women tend to be somewhat similar. So in that situation, you will see more typical chest pain, pressure, and also very importantly, what a lot of people manifest as well, is that they get what we call in cardiology associated symptoms. They may become nauseated. They may get profusely sweaty, I mean drenched sweaty. So in that situation with a heart attack, the symptoms may be somewhat similar, but where we typically miss the boat is because the symptoms leading up to the heart attack event may be atypical in women, whereas in men they may be more typical and they'd be more classical.
Barnabas Health. Life is better, healthy.